talked all the time about potentially preventable admissions and readmissions and waste in the system, right? The orthopedic surgical intervention that wasn't needed, as you were talking about earlier, and the need to drive those costs down. And there is a real need there because those are the drivers of costs in the healthcare system. Overspending in primary care isn't really our primary problem when it comes to healthcare payments and waste in the system. There really isn't. I've looked for it. I have not yet found, maybe you or some of your listeners can find a clear definition of potentially preventable primary care. I'm not saying it's all perfect, but the waste isn't really there. The problem with primary care,
it doesn't cost that much. I mean, from the $3.4 trillion healthcare budget per year, I don't know what percentage primary care is, but it's tiny.
It's teeny tiny. And so there's this real disconnect between sort of utilization of so some have looked at Medicare, for example, and they've looked at utilization of primary care in Medicare relative to reimbursement, and the disconnect between the payment and the ratio of use, it's unbelievable. There's no parity there or even close to it. So I think that we have to have a conversation about increasing investment in primary care alongside a conversation about value-based payment. Because for many community health clinics that are operating on really, really thin, they're nonprofits, but, are kind of making it work, right? Between grants and the PPS and other sources of funding, when you start to talk about taking risk and losing money, that's a really difficult proposition in that kind of environment with the obligation to serve everyone who walks through your door. But if you're talking about increasing investment in primary care as a proportion of kind of total spending on a person, because that's not where the waste is, if anything, they need to come in more, then I think you can have a really productive conversation about value-based care models that you see prevalent in hospital-driven kinds of models.
Okay.